This study that I'm going to talk about deserves a standing ovation. That is because it talks about the effect of sedentary behavior on cognitive decline. So this was a study that was conducted on approximately 400 adults, where they gave them a wristwatch which estimated the amount of time they spent sitting. And most of these subjects were physically active. So they had approximately 87% of these subjects were physically active. And in spite of that, over a period of follow-up over 7 years with neuropsychological assessment and very detailed MRI scans, they found that there was a direct correlation between time spent sitting in spite of the physical activity and cognitive impairment over a 7-year period. So this is a very powerful data point that we should all take notice of. That even though you may, for example, work out in the morning for 90 minutes or 60 minutes or 45 minutes, then you go back to your life where you're spending a lot of time sitting, this may have a negative impact on your cognition over a period of time. But trying to limit your sitting is crucially important. As you all know, sitting is considered to be highly associated with many chronic diseases like type 2 diabetes, cardiovascular disease, and so on. And now there is evidence to suggest that there could be some relation with brain aging as well. So how does this likely happen? It's believed that sitting for too long leads to impairment of glucose control during the day, and that can lead to fluctuations in glucose, even in non-diabetic subjects, leading to cognitive impairment. So one of the ways of offsetting this problem is to do something known as soleus push-ups, which I've spoken about in previous reels. It's a very interesting study from the University of Houston, where they made subjects do soleus push-ups, which is essentially you place your feet on the floor and then raise your heels up and down as many times as you can during the 1 hour that you're sitting. This will help to modulate your blood glucose levels because the soleus is a unique muscle that does not use stored glycogen, but uses energy from the blood, the glucose in the blood, to perform these contractions. So possibly one of the ways is to limit your sitting time. The other way is to, when you're sitting, to perform soleus push-ups so that you can offset the effects of sitting on brain aging.